female. Their ages range from the 20s through to the 70s. One case is travel-related, 2 are close contacts of other cases, and 3 are community-acquired. So this is a shift again back towards more of community-acquired cases from what we saw yesterday. And once again speaks to the importance of people exercising, physical distancing. It's transmitting through the community, and therefore people need to be aware of that and taking their precautions, avoiding crowds, keeping 2 meters distance from other people. Certainly not going into work when your work has been closed down due to government direction. And going into self-isolation if you develop any symptoms of a respiratory infection. Certainly should be in self-isolation if you've come back from out of country within the last 14 days and should be off for 14 days. As I said, this is the time right now for us to be acting really well with the physical distancing to reduce transmission in the community, to flatten the curve so that we avoid that surge of cases that could overwhelm our healthcare system. Going back and looking at our new cases, we have 2 of them that are hospitalized. Both of those individuals are older, one in their 60s, one in their 70s, and both have pre-existing medical conditions that would put them at risk. So because of age as well as comorbidities or other medical conditions, that would put them at a greater risk of needing hospital care. And both of them are community acquired. They did not have contact with a known case, and they did not travel. One thing I need to acknowledge is that among the 5 new cases, we now have an individual who worked at a long-term care facility while they were infectious. So the site in question is Spencer House, and we are investigating to see if there are identifiable impacts, whether there are potentially other cases or not. We do, according to the provincial direction, treat any long-term care facility that has a single COVID case to be in an outbreak, and all the investigation and preventive measures that are required to respond to an outbreak are then put into place right away. So indeed, we're going to be following up very aggressively with that site. If you look at our website, just taking you through our overall data, we still have a predominance of people in their middle years as cases, the most common age range being 35 to 64. We have more older people affected now, 65 years of age and above, 15 of our cases. If we look at the status of our cases, more of them have now recovered than yesterday, which is certainly very good, 12. We have 29 in self-isolation, and we're up to 11 of them hospitalized who still remain with 4 deceased. We haven't had any further deaths in the past 2 days. And if you look at the source of infections, as I said, 3 of the cases out of the 6 for today are community acquired, but if you look at the total of all of the cases, the majority still are travel related at 31, 11 are close contacts, community acquired 14. The number of community acquired is growing. As I said, it's shifting. It's shifting from travel related to transmitting in the community. I do believe we are under measuring the number of community cases because the emphasis so far to date has been on looking for travel-related cases, and so the community-acquired cases are being picked up because they're severe cases, the ones that are hospitalized. So I suspect there are many others that aren't being tested, that we're not picking up. It speaks to the fact that there is community transmission happening, and therefore people need to take their precautions to avoid transmission. If you look at our what we call an epidemiological curve, it's the plotted cases day by day from the very first case on February 23rd, and these are the dates in which the cases began their symptoms rather than the date that they were tested or the date that the result came back. So if you look at that graph, at this point you're seeing some rise, but you're not seeing a huge upswing. So far a fairly flat distribution, and it's too early to say whether that will continue or whether we will see the big swing upward. We cannot be complacent. Everybody has to exercise these community control measures with your physical distancing to avoid that upswing, but at this point we're not seeing evidence of a huge upswing. If I take you down through the list of cases, you'll see at the bottom the most recent cases, and that would take you from 52 onward. As I've identified, there was one case that was travel related. We've got the other cases that are community acquired and close contacts. And the age range I've already discussed. Their home locations are all various places in Simcoe County, none today from Muskoka or in Muskoka. Just to go through a couple of key points that I have on my list. We are working very hard to protect people in long-term care facilities. They are very vulnerable. Certainly there's been a lot of media profile on deaths that have occurred in long-term care facilities, cases that have occurred in long-term care facilities. This virus can have devastating impacts in long-term care facilities because the people there are very vulnerable to it and are at very high risk of having serious outcomes. So we need to do all that we can to protect those facilities. That means also that people need to stay home if they are ill. So certainly you should not be going to work if you are ill. You should stay home in self-isolation, and if you develop severe symptoms, certainly shortness of breath, then you need to be assessed at an emergency department. If you are a healthcare worker or you work in a long-term care facility, or if we're talking about people from remote communities where it's difficult to get health care or belong to a First Nation, then you would certainly be priority for being tested according to provincial direction on priority groups. It's very important that those who are ill stay in self-isolation and not expose others in the community. And by self-isolation, I mean you stay home. You don't go out or leave your property at all. And even in your home, you need to be separated from other people who are well. Preferably you have your own room, you have your own washroom, you're eating separately. And those individuals need to be monitoring themselves for symptoms, and if we've have approached your household because you have a positive test result, then those individuals will end up being in self-isolation as well, monitoring themselves for symptoms. Also, people who've returned from travel within the last 14 days from out of country need to be in self-isolation for 14 days and can only come out of self-isolation if they're still well at the end of that 14 days. And that is now prescribed under the Federal Quarantine Act and will be enforced. We also have some questions that came up yesterday that I said I would get back to you about. So there was a question about why did the Collingwood Assessment Centre move away from the hospital? And the answer is that they chose a new location. The Collingwood Assessment Centre moved to a new location to increase their capacity and improve their ability to do testing at the site. It's now being staffed and coordinated by Georgian Bay Family Health Team and the Family Health Organization, whereas before it had been operated by the hospital. Just checking one bit of information for you. Yeah. Okay, if you come to our web, here we go. The location of that, Georgian Bay Family Health, it's located at the Georgian Bay Family Health Team at 186 Erie Street Medical Building, parking lot, Collingwood. So you can find more information on all of our assessment centers in Simcoe, Muskoka at our website. Now, yesterday I also announced that Muskoka was opening up its 2 assessment centers. I had been told that that was the case, and then I learned later in the day that they had decided to wait until today to be fully prepared. So they have opened today, or are opening today. There was a question about whether what measures were in place to ensure infection control, not put people at risk of being exposed to crowds. So visits are by appointment only at this point, and those who come are encouraged to wait in their vehicles to avoid people in the center all at once, to avoid the crowding. So that's the information that I have for you today, and I would be happy to take questions.
Thank you, Dr. Gardner. We'll start with Sean from CTV. You may be on mute.
Hi, Dr. Gardner. It's Sean Gardner from CTV. So I just have a quick question. So with regard to the cases, if 5 new cases are announced today, what would be the total case count for Simcoe Muskoka District today, if that's not reflected on the website? Is it 62?
It is 62, yes. It's just that the last 5, I can't give you detail about them because they just came in.
Those last 5 that announced this morning, you can't talk about today, correct?
The cases from 58 to 62, I cannot give you detailed information on because they just came in.
Okay.
Anything else, Sean?
Yeah, I do have another question. Regarding the province put out something on their website saying that if you took the online assessment tool before March 27th, you're asked to take it again because there's been some new information regarding people coming back to the country and those at a higher risk of contracting COVID-19. Can you speak to that at all?
I must admit that I would have to look at that myself to see the details of what's been changed. I do know that the case definition has shifted away from travel out of country to travel in an affected area. I think in recognition of the fact that travel alone is not the risk or the prime risk anymore. We have it right here transmitting in our communities. I'd like to say travel still is important. Anyone coming from out of country still needs to go into self-isolation for the 14 days because the risk is high, but it's not the only risk anymore. We have it happening here in our own communities.
The recording was cut off a little bit. I know this is added on YouTube, so I can get that after, but can you just, if you don't mind, could you just do a breakdown of the cases again for us, if you don't mind, or is that too much to ask?
Well, at very high level, that we have 6 new cases that 3 of them are male, 3 are female. Their ages are between the 20s and their 70s. One is travel related, 2 are close contacts of somebody else as a known case, and 3 are community acquired. 2 are in the hospital. Those 2 are individuals who are older in their 60s and 70s, and they both had pre-existing medical conditions.
Okay, so so 3 male, 3 female, ages 20 to 70s. 1 is travel related. You said 1 is community acquired?
We have 3 that are community acquired, 2 are contacts of other known cases, 1 travel.
Okay, and the 2 in hospital, 60s, in their 60s and 70s, and have pre-existing medical conditions?
They do, and they are both community acquired.
Okay, so 3 male, 3 female, ages 20 to 70s. 1 is travel related, 1 is community acquired. 2 in hospital, 60s and 70s with pre-existing medical conditions, both community acquired. Is that correct?
Yes.
And you should be able to find that one on the chart.
Yes, I just wanted to confirm. Thank you so much. Appreciate that.
All right, next question. Mandy from Rogers.
Hi, Dr. Gardner. I just wanted to ask a quick question about people who have been hospitalized. Have any of them been recovered and released from hospital, or everyone who's originally been hospitalized, are they still there?
Do you mind if I look into that and get back to you? We've got like the total number of cases that have recovered, but I don't have a breakdown in that on that figure as to how many had been in hospital. So I'll get that for you tomorrow.
Thanks so much. That's it.
Okay.
That's it. All right. James Bowler?
Yep. Hi there. Thank you. Dr. Gardner, we had a release today that there was a respiratory outbreak at the Pines long-term care home here in Bracebridge. Obviously, the testing is still underway, and I know testing is quite far right now, but I'm just wondering if you can comment on that situation because of what's happening above Cajun. I know a lot of people are high tension right now at the long-term care home, so if you could just comment on that situation.
So I think that people are rightfully concerned about any outbreak, respiratory outbreak in a long-term care facility. They are common through the winter, and at this time of year we have a number of facilities that have respiratory outbreaks. All are under investigation and have had laboratory tests submitted. None had come back to date with positive COVID testing. The only home we have in which there is a definitive positive test result for COVID is Spencer House, and the positive result is in a staff member, and that is very new information for us, and we're investigating it right now.
All right, and sort of along the same lines, your TV had learned yesterday that there was an employee of the Beaver Creek Institute that was confirmed to have COVID-19. Obviously keeping in consideration that we can't release names or identifications. Was that, I don't know if you can answer if that was in the Muskoka area as well or in our health unit area, that specific employee. It didn't seem to match up with any of our expected area. So
that is, we do know of that. We are investigating that. We have not identified any other cases related to that. We have to work with the federal government on that because that lies in federal territory in terms of jurisdiction. In terms of that as a work site and in terms of that as a place where inmates could be infected. So we're aware of it. We are investigating it.
Just a really quick follow-up on that specific one. Was that specific person, they told me that it was a confirmed COVID-19 infection. Was that travel related or was that local?
Offhand, I need to look into that and get back to you about that.
Okay, thank you.
Okay.
Thank you. Okay, we'll move on to Brett Glover.
Thank you, Leslie. Dr. Gardner, we heard this morning of a report stating we can start seeing restrictions being lifted around July 1st. You've been telling us all along this could take months, but does July 1st seem reasonable to you?
It's possible. It depends on what this virus does, and even that, of course, would be months. But it is a respiratory virus, and it falls in the coronavirus family. And typically, those viruses decline with warmer weather into the summer. It is possible that it will decline into the summer, and then entirely likely that it would return again in the fall. So many of us believe, and the projections on this, the mathematical modeling on this suggests that it will recur in waves, and that we will need strategies in place to deal with those waves as they return until the day that we get a vaccine or another means of truly bringing it under control in our population. So it may be gone in the summer or it may not. It is a new virus, and so we cannot know for sure at this time.
Fair. But from a medical viewpoint, what do we start needing to see before allowing some return to normal in terms of gatherings, restaurants, and the like?
Well, certainly the controls we have in place right now are a tremendous hardship to society and to us all, and to the economy and people's livelihoods and their ability to have a living and enjoyment of life. And so it's extremely hard on us all and hard to sustain. In the end, it rests with the provincial government to decide when to lift such restrictions. If, in my mind, it would make sense for them to do that in keeping with the epidemiology that we'll see. So if we get to the point like China, where indeed it's been brought well under control and the numbers are very low, the numbers of new cases, then that would be the time for them, I think, to start looking at easing controls. But they would have to keep a close eye, even then, on what's happening for the potential for recurrence. And it may very well be that our control doesn't coincide with neighboring country levels of control, and therefore you have the potential for it to be reintroduced again with travel from out of country. So I think we shall see, no one can know for sure, but we may very well be into this for a very long time, with it waxing and waning, and with our controls in place, and then our controls easing up, and then potentially going back into place.
Thank you.
You're welcome.
All right, next we'll have Nathan.
Good afternoon, Dr. Gardner. How are you doing?
I'm okay. How are you?
Well, thank you. So, follow-up to James Bowler's question about the respiratory outbreak at the Pines. So, there's no confirmation that this is related to COVID, correct?
That is correct.
Okay. And with this respiratory situation, is there a chance that this could evolve into, or give the chance for COVID to make its way into the homes, or make the people more vulnerable?
Well, I think the prime concern is making sure that this isn't COVID to begin with, right? That the cause of their outbreak not be COVID, that it be something else. And so testing is critical, and getting results on testing is critical. And of course, having the control measures in place that we put for all outbreaks is critical as well. So appropriate use of masking, and isolation of cases from non-cases, and continued surveillance for cases, and controls with regards to people being allowed back into the facility, or controls when people are going out of the facility, perhaps to hospital for care, to avoid spread to a hospital if they receive a case. All of that's really important. It always is anyway, no matter what the organism is, but if it's possible that it's COVID, then it's all the more important that all of that be in place. I think another possibility would be that this is something else, but they're still vulnerable to getting COVID just like any other facility. And so the controls that the government has put in place to prevent that for all facilities, such as a prohibition of visitation, would need to be in place to address that issue as well for them.
Great. I think that's it for me.
Thank you, Nathan. Doug Cross?
Well, with the new assessment centers in Muskoka, is there going to be a more fulsome aggregation of testing that's being done in terms of numbers of people that are tested, et cetera? Is that going to be a new feature of the off-unit reporting?
We can do that. I think perhaps you're asking for the figure of the total number of tests that have been done to date, and maybe broken down as a rate for the population comparing Simcoe and Muskoka. Would that be the kind of thing you're thinking of?
Yeah, I mean, we've obviously already touched on it in some of our other stories, but I think people in the Muskoka area, starting from zero testing at this new facility, they'd be interested to know numbers of people that are actually accessing the site, that type of thing.
I'll see what I can do about getting that data. And I think for it to be meaningful, it would be a comparison, maybe Simcoe versus Muskoka. We'll see what we can do.
Sure. All right, terrific. That's all for me. Thanks.
Okay.
Thanks, Doug. We'll move on to Adrian, please. Maybe on mute, Adrian? Adrian, are you there? Okay, we'll skip ahead to Erica then, please, and we'll come back to Adrian.
Hello, my questions are regarding the Aurelia healthcare worker case. Do you know how long they were infectious and still working for?
So because that's just come in, we're just beginning our investigation, and I wouldn't be able to give you that information at this time. I'll have more information tomorrow.
Do you know if they got the virus from work or what the transmission was?
At this time, I don't know because it's just come in.
Okay. Can I just ask one more question then? The Bradford case, the hospitalized one, number 57, what hospital are they at?
Okay. So one of these cases, there are two hospitalized cases. One is at RVH and the other one is at South Lake Regional Hospital.
Thank you.
Thank you. We'll move on to Chris Simon.
Thank you, Dr. Gardner. My question was also going to be about Spencer House. With, I guess, this person who tested positive for COVID-19, they would be in the case 58 to 62 range then?
Yes, they're among the cases that we've yet to gather information to provide.
Okay. I'll switch gears then, because obviously we're not going to be able to answer any more questions on that. By my count, I've gone through the Simcoe County municipalities, and it looks like all but 3, even if you include the separated cities of Barrie and Aurelia, have at least one case of COVID-19. You're not surprised by this community spread, are you?
No, I think that there's much more in the way of community spread than what we're seeing in this data. It's partly a testing bias. We, with our criteria in the past, have been focusing on travel-related or contacts of cases. And so we're not getting as many of the community-transmitted cases that are there. The cases that you do see that are community transmitted are overwhelmingly severe because we're also testing severe cases no matter what, right? So therefore, of all the community cases that are there that could be tested, the ones we're testing are severe. I think there's much more in the way of community transmission than what we're seeing in the data.
Thank you.
Okay, we'll go back and see if we can get Adrian on the line. No? Okay, is there anybody that's on the line that we missed?
Yeah.
No, I
Sorry? One at a time?
Yeah, Dana from Global News.
Oh, Dana, hello. You want to ask Dr. Gardner a question?
Yeah, so, sorry if I, this is just confirming that one person who is in Spencer House, the details on that we're not privy to the details on that yet, in terms of when they actually last entered the care home there.
Because that case has just been reported to us late this morning, we don't have detail. We are investigating, and I'll have more information for you tomorrow.
Right, okay. And are all of those people who are sort of coming up to the recovery stage, are all of those people receiving those 2 tests to ensure that they do not have the virus any longer?
So the only ones who would require that, according to our protocol, are healthcare workers or people who are presently hospitalized. The others are considered no longer cases 14 days after the onset of their symptoms and after the end of all of their symptoms, whichever is longer.
Right. Okay. So with those people who wouldn't qualify to get those 2 tests afterwards, how long would they have to self-isolate them after they stopped experiencing the symptoms?
they have to be symptom-free and otherwise 14 days from the onset of their symptoms. So there's not a period of time. At one point we were saying 24 hours after the symptoms were recovered, but then our protocol has changed over time with the understanding of the disease and direction from the province. So at one point we were saying 10 days after the onset of symptoms or 24 hours after the cessation of symptoms, whichever is longer. And now, with direction from the province, it's 14 days after the onset of symptoms, and they have to have recovered from their symptoms completely. So, the protocol has changed. It's a longer period of time than it used to be, but without a stipulation about how long after the symptoms are over. Merely that they have to be over.
Okay, thank you.
You're welcome.
All right, sorry, there's someone else on the line?
It's CTV again. I just want to confirm one thing. Sorry, we reported yesterday there were 55 cases. So if there's total 62 cases today, that would mean today that there's 7 new cases, but 5 under investigation announced today.
By that method of counting, that is true. There's this differential between what we have listed that I have detail on versus additional cases that have just come in that I can't speak to, that perhaps could lead to, a different way of looking at how many new cases we have.
Yeah, we're just trying to include the new cases today that you'll give information on for tomorrow.
That's right.
So we're just trying to get a case count. So So would it be correct to say there's 7 new cases today, 5 of those cases are under investigation, but the total case count is 62? Can you confirm?
Yes.
Thank you, Dr. Gardner. Appreciate that.
You're welcome.
Okay.
Leslie, I'm sorry. Can I get in a question? It's Erica from Collingwood today, and it's just regarding a memo from the Ontario Chief Medical Officer of Health to public health units, just urging them to implement more aggressive contact tracing and management as we work to flatten the curve, and it's referring to the Health Protection and Promotion Act. So I just wondered how that changes the Simcoe Muskoka Public Health Unit work when it comes to contact tracing and how that extra aggression or aggressive contact tracing will look.
So that's just come out this morning, and we need to look at that, carefully consider what it means, how we would interpret it, and then look at what we're doing to see what we need to change. I also understand that the medical officer of health in Toronto, according to communications, is looking at issuing orders under the Health Protection and Promotion Act to individuals who should be going into self-isolation. So we need to look at whether or not that's necessary. Our experience actually has been that we found a high degree of compliance among all of the cases and their contacts, and so we'd have to ask ourselves whether or not there's added value or need at this time to issue orders. Usually we reserve orders for instances where people are not complying, but that's my immediate impression. I think we need to carefully consider this and decide what else it may mean, what else we should be doing.
Okay, and regarding the outbreak status now at Spencer House, what does the health unit do to support that long-term care center for, I think you called it outbreak protocol?
Yeah. So we contact them, we go on site, we ensure that they have sufficient swabs to test all symptomatic residents and staff. We follow up with the Public Health Laboratory to expedite the testing. We make sure that all the other control measures are in place. Nobody should be visiting anyway because of the provincial directive, but we make sure that's the case. We make sure that there's availability and use of personal protective equipment by the staff to prevent spread, that all joint collective activities are not happening. That too shouldn't have been happening before anyway because of provincial direction. That cases are isolated from the others, that there's enhanced disinfection, that there's excellent surveillance for cases, the identification of new cases, and follow-up isolation of any new cases. Of course, we ensure appropriate reporting to the Ministry of Health, and I'm sure that the media as well, on an ongoing basis, will have a strong interest in this, and so we need to be prepared for that.
Thank you.
You're welcome.
Sorry, I just want to make sure no one was on that didn't get a chance to ask a question. Okay. Seeing that then, thank you everyone for joining us, and Dr. Gardner will be back tomorrow at 1 p.m. and we'll do this all again.
Thank you.
Goodbye, everybody.
Service everywhere up here, and Barrie ended up being our home. I think Barrie was possibly our home because of hockey, because we were very into hockey when I was younger, and I got a feeling maybe we chose Barrie out of all the Simcoe County areas for hockey.
Yeah, well, Barrie's always had a
That's just
solid
it.
background.
Yeah. So if I had to, I've had to think about that. It was probably because of hockey. Yeah.
Yeah, cool. Now we go back a few years as well. I remember I'm going to date myself here and date you as well, unfortunately.
Yeah, that's all right.
Probably, I'm thinking probably about 15, 16 years ago, maybe even a little bit longer. You had a band called Trigger Incident, which many people in this area may not know about. Tell me a little bit more about Trigger Incident.
Yeah, and that one's like there's even a couple that we've breezed over.
So
That's okay, but let's go. Trigger Incident was a really fun band. It was at a time in my life where I needed to get some anger out. Because the band before that was quite a lot happier. We were singing love songs and in major keys, and then had a breakup, and it ruined me, and I was angry, and I needed to get it out. So my way of getting it was starting a progressive, I don't know what you call it.
Yeah,
it was kind of progressive,
I would say, yeah.
Metal-ish in that genre. I don't know. Anyways, that was my way of getting it out. So Trigger Incident was spawned from a really angry Brett. And luckily I have some insanely talented friends, and I recruited Leland Bermane, who now plays in the Indian Handcrafts.
That's right.
And Brian Lake was on the drums.
That's right.
He's still a dear friend of mine.
Yep.
And then Evan Rosevere, who I'm not in touch with as much anymore, but he was an incredible bass player. Studied at Humber. That was the band. That was Trigger Incident.
Yeah. No, it was. I thought it was a great band.
It was a great band.
It seemed like you were here, and all of a sudden you weren't there anymore.
Yes, and that was the anger. Yeah, before Trigger Incident was a band called Fight Like Gentlemen.
Okay,
Actually started as Junior. And that was with my friend Tony Cervello, Dave Murray, and Rob Drake. Rob Drake is still my musical brother. Junior, and then Junior changed the name to Fight Like Gentlemen, and we were just a little popular. It was still kind of progressive, actually. Like we like to mess with our arrangements, but it was definitely happier sounding. And then I got angry and started doing the darker stuff. Yeah.
But happier days were ahead.
Easy come, easy go, whichever way the wind blows. Gotta hold on to what you got before it's gone. Where you think you wanna be is never as it seems. The lights change, but those shadows, they still remain. What is it you think you want? Don't you know curiosity always kills the cat? Where the grass is always greener on the other side. No matter what side of the fence that you stand upon. if you could only see over the other side, well, you know it's not all that it is cracked up to be. Should you stay or should you go? That ain't your question, we all want to know. Well, the answer lies only within your heart. Just be here right now, 'cause there's no other place you need to be. At your fingertips lies happiness and beyond, where the grass is always greener on the other side. Yeah, no matter what side of the fence that you stand upon. And if you could only see over the other side, well, you know it's not all that it is cracked up to be. When opportunity comes knocking at your door, no need to answer, you don't need her anymore. You've got everything right where it needs to be. Easy come, easy go, whichever way the wind blows. You've got to hold on to what you've got before it's gone. Where the grass is always greener on the other side. Oh, no matter what side of the fence that you stand upon. And if you could only see over the other side, you know it's not all that it is cracked up to be.
Transforming from the rock and roll, and you said it was a bit of a lyrically, obviously you had some things that you were getting out.
Yes.
Now, when you went from the rock and roll thing to solo acts, because you were basically when people say, "Oh, I'm going downtown to Kensington's or to Donnelly's or wherever," you're kind of a staple downtown, British Arms, wherever. You're like the guy that, "Oh, I'm going downtown." There's a good chance you're going to run into Brett Caswell. Are you still gigging the solo stuff as much? And did you enjoy that more than the rock and roll thing, or?
Oh, man.
Sorry, tough question.
Loaded question. I did. I was that guy for sure downtown for 10 years probably, man. And that started the gigs, doing the cover thing, and that started out of necessity, needing to pay bills because I had a son. And writing original music and playing it on the road and in bars was not really paying the bills. So playing some cover songs paid the bills. That's how that got started, I guess, really. That's kind of how the solo thing, solo acoustic thing got started, out of necessity. And boy, oh boy, did I drive that to the ground.
Yeah.
I played every one of these places in Barrie too many times, I think, because now I can't do it anymore.
However, on a good note, we are here sitting talking about this.
This is right.
So let's fast forward a little bit to where we are now, and especially in this place, the temple, because this is your home.
The Temple
for
Lounge, yes.
The choir.
Yeah, it is.
This has been such a phenomenal what's the word, diversion as to what you've done in the past.
Yeah.
How did this whole concept come about with the choir? It is really unique. I think for Barrie anyway, it's a very unique and a wonderful opportunity to get the community involved. But, so how did that idea, that concept come to reality?
Actually, very similar to Trigger Incident, how that was born from an angry place. The choirs are born not from an angry place, but a darker place. Those gigs I mentioned earlier kind of drove me into a bit of a deep dark depression. It was a hole for sure. And the choirs helped me get out of that. The choirs are born from needing to find joy in music again, and yeah, and that's what happened there, man. It was I had to get, for some reason, my life had to go pretty dark for these choirs to happen. So I'm thankful that I got there, I guess, in a weird way. You know, I'm thankful that I had to go through all that pain. Yeah, so that's how the choirs were born, from that.
So with that, getting to the point, how did you get the people to come to the masses? How did you bring the choir concept to the Temple Lounge here at Donnelly's? Was it taking your idea and then marketing it through there? Do you know what I mean? Has it been, how did you get to this choir happening at this point?
That's a good question. Well, really, first and foremost, the idea isn't original, right? I'm kind of borrowing from Choir in Toronto.
Yep.
If you haven't seen their videos, check them out, because holy smokes, they do some incredible things. And they have a really simple format, and it works really well. You don't need to read music to be able to do what we do in this choir. It's all by ear. And so I used I came up with the concept, I borrowed the concept, and then just used social media as my tool. You know, that was pretty much it. And word of mouth. Started small. There was some nights where there was only 15 of us maybe, and now we're up to anywhere from 40 to 55 people in a night, maybe. Yeah. Yeah.
Well, I think it's a cool concept. It's wicked. How do you choose which song you're going to perform? Is it a kind of a popularity vote, or do you just think this is a kind of a classic song that everyone will know? Yeah, for the most part, like I'm trying to keep them accessible at this point. I'm sure maybe down the road we'll get into some B-sides maybe. Yeah. But right now, keeping them accessible. I do spend hours and hours researching, and because even if a song is accessible, doesn't mean it's necessarily choirable. You know, it might it might be an awesome song that everybody knows, but it won't necessarily make a good choir song. Yeah. And the cool thing about it too is that it's open to all ages. Yeah. It's what kind of a demographic are you getting with these shows? Well, the one that we do here, we run these on Tuesday nights here at Donnelly's, and those are just adults. So that one, it doesn't have to be 19 plus, but it tends to be, and it tends to even be even a bit of an older crowd. But I also run 2 not-for-profit kids choirs as well out of Homestead Bakery, and those are on Mondays. Okay, cool. So that's actually the adult one is set up to help fund the not-for-profits. So everybody who comes in here on a night pays a $10 donation, and that goes to help fund the kids choirs. Gotcha. Yeah, man. Nice. Now, you talked a little bit about mental illness, and as an artist and as a musician, from a crowd perspective, they don't understand really what's going on behind the scenes and the battles that, like everyone else, faces, whether it's physical, mental, whatever. And musicians tend to, I found anyway, we deal with things differently. Some put out lyrically, some use whatever means they need to disguise their pain or their troubles before they go on stage. With your mental illness, how do you deal with it? Do you find it a combination of writing, or is it dealing with it in other ways? For me, the choir, I guess, has been a huge part of my therapy. Making arrangements is kind of my new writing. Making these choir arrangements. I don't work on my own music a whole lot these days. I don't have time. I'm busy making a lot of choir arrangements, but I'm working all the same parts of my brain. It feels like I'm writing a song almost when I make an arrangement. When I finish it, I get that same feeling of like, you know what I mean? Like kind of proud moment where like, you finish something. Yeah. And so I get all the same feelings with writing music. I get that from making choir arrangements, which is pretty neat actually.
Yeah. So, what was the original question?
Yeah. So with mental illness and with being a musician. Yeah.
Yeah. So choir helps, and actually, I couldn't. Performing isn't really. I had some panic attacks on stage through this mental illness, and so performing has been an issue actually. Actually, once I got off this stuff, this, so you know, is non-alcoholic. I don't use the booze anymore. No, after I got off alcohol, I tried to keep playing shows, and it wasn't working. Like when I wasn't on the same level as the rest of the bar, and everybody else is getting wasted. I ended up panicking on stage and realized I can't do this anymore. Holy smokes!
How do you deal with a panic attack on stage?
I had to, like, luckily it was in between sets, like, so I just packed up and left. Like, didn't even say bye to the bar, nothing, just booked it. Yeah, so playing on music live isn't really doesn't really work for me at this point in my life, but that's being worked through. I guess just the bar gigs, because I still do the songwriter series, and that's a lovely gig. But everybody's sitting, you know, everybody's listening, and it's a bit of a different style of a gig. And exercise is huge for me, man. Exercise, a little bit of yoga, meditation, those are actually paramount for working through my through my mental illness and getting off the alcohol. Again, like, this is a fake beer, and it does a great job of tricking me because I still enjoy the taste of beer. But I think that was the biggest thing, was kicking the alcohol. That really helped me. Yeah. This one's for my son. Every morning when I wake up, I hear you calling out my name, saying, "Daddy, won't you come get me in my favorite Monkey Marv? Would you like some Cheerios? Maybe some scrambled eggs and toast? Be sure to eat everything on your plate, because you need your energy. And if the sun don't shine, everything's alright. We'll spend the day inside. You run, I'll hide. After breakfast, put some clothes on. We'll tie the laces on your Superman high tops. Out the door and to the park we go, with nothing but fun in store. Fill your pockets with the stones we find along our merry way. We'll throw them up and down that big red slide, anything to see you smile. And if the sun don't shine, everything's alright. We'll spend the day inside. You run, I'll hide. It's days like these I remember why. Well, I was put here to live out this life. It's you, the reason why. Every day, every night, and every moment of our life. The sun don't shine, everything's alright. We'll spend the day inside. You run, I'll hide. And if the sun don't shine, everything's alright. We'll spend the day inside. You run, I'll hide. Later on into the evening, clean you up and get you into your PJs. Read the story of your choice while you nestle up into my arms. Lay you down into your bed. We'll tuck you in and give a great big hug and kiss. Say goodnight and that I love you more than you will ever know.
You have a very creative mind, obviously. Otherwise, we wouldn't be sitting here talking. Yeah. But between your solo, the rock and roll thing, and now the choir, what's going on after this? Have you got plans for down the road, or are you just going to kind of take this as long as it'll ride, and then wait to see what falls from the gods?
Yeah, usually I kind of just go with the flow. And so before I played live all the time, I taught for years. So, and I do have a pattern of just beating things to death. So, because I taught for years and I taught so much. I had, you'd have 50 students on the go at a time. And by the end of teaching, I was starting to get a little cranky. I got a little jaded, and I definitely got out when I should have. Yeah. But because I was starting to beat it to death, kind of a thing. Yeah. I was losing my patience for it. And then that happened again with music too. I beat the gigging to death until I hated it. So I hope that doesn't happen with the choir. This is what I'm hoping, okay? Because this choir is so joyful and so lovely, and is bringing so many people together in this great community. So like, here's the hoping that that doesn't happen. I'm pretty sure it won't, because this is a very different adventure, and it involves so many more people, and there's just so much energy around it. I think this is it for a long time. Yeah. For sure. Yeah. I could picture myself being on this stage, or on a choir stage, leading choirs for a long time.
Awesome. Well, I must say it has been one heck of a great pleasure to finally be able to catch up to you, because we have been trying to do this for a little while, and we've been playing tag and everybody. We finally got our opportunity to sit down and chat, and it has been a sheer pleasure.
I was ready to just keep blabbing too.
Oh yeah, well that's the good thing about these interviews. Just let them keep rolling. But no, it has been a sheer pleasure chatting and catching up with you again, Brett. It's been a while. Yeah. Thank you very much.
Thank you for having me.
You're very welcome.
Every morning when I wake.
At Kawartha Dairy, it's been 80 years of fresh, delicious dairy products and 80 years of incredible memories. We've come a long way since 1937, and it's all thanks to our amazing customers. Thank you, Ontario. Here's to 80 more years.
Call the Rogers TV viewer response line, email us, or connect with us on social media. This is Rogers TV. Barrie.
It's so inspiring to know that there's people out there that are willing to help people who've gone the situation that I've gone through. Because of United Way, I'm able to stand in front of you today with a good job that I can actually make something of myself.
For my kind, there was one place we were never allowed to go. Your world.
What are you gonna do?
Show this world for what it really is.
This is Rogers TV.